I still remember opening the letter from the Palliser Health Authority saying that Karen and I were awarded a contract for a long-term care facility in Cypress County. We were elated. After years of working as a recreation therapist and program developer and a registered nurse in large facilities, our passion was to use the social model of care for people with dementia and mental health. We wanted to focus on creating natural environments that residents would identify with. 25 years later, the benefits of this approach have become so apparent for both of us, and it seemed important for me to volunteer for the Behavior Committee with Alberta Health Services South Zone. As a committee, we were asked to start exploring the use of code white simulations with our staff so that as a zone we could learn better how to de-escalate without the use of medications or restraints. Less than a month later, prior to one of our music programs, a female resident named Gracie was displaying some aggression and agitation. Her sweater was twisted and appeared extremely uncomfortable. The healthcare aide had not been able to adjust it because of her emotional state. I was on site and decided to have a team huddle to see if we could use this situation as a learning opportunity. I asked the team, what routines have been different about today, yesterday, or even last week? And in our conversation, we realized that Grace's husband, who visits every day, had not come for 2 weeks because he was on vacation. I asked the group, what's different now than when Gracie's husband visited? And we were able to identify that they would eagerly engage in music activities by singing and dancing, and that hadn't occurred while he was away. We decided to create a real-time code white scenario. After years of using music care strategies that I had learned from an organization called Room 217 Foundation, we knew that music programming could help her. So I started with a song that Gracie enjoyed while a healthcare aide stayed with her and monitored her behavior. As the music began, we immediately noticed a change in her demeanor. Gracie stood up straight and started to walk in the direction of the music. As she approached, I slowly walked over and directed the song to her. As she danced and sang with other residents, the healthcare aide was able to rearrange her sweater comfortably without any resistance. After the music program finished, we had a debriefing huddle and decided that from now on, we would track all music that residents like so that we could use those songs as a behavior tool. Since then, every resident has their favorite songs, community inclusion activities, and daily routines documented, and this information is used on a daily basis. Ever since taking this positive approach to behavior tracking, the number of moments of agitation have decreased significantly over the past few months, and the staff tell me that the home feels more peaceful and satisfying. Ever since that music program, Gracie hasn't had a bad day.